professor in the Department of Human Anatomy, Medical Physiology. I'm also the chairman of the team. I'm a practicing obstetrician gynecologist, scientist, and women's health advocate.
My name is David Adoyo. I'm a research scientist in training at Obimbo Lab. I have a background in medical laboratory science, and I'm passionate about research.
My name is Samuel Chenge. I'm a molecular and data scientist. My work involves creation of libraries, troubleshooting molecular workflows at the Obimbo Lab.
So Obimbo Lab is actually a name of the team members that are working every day to make sure that women's health is guaranteed. There are quite a number of things that we are doing at Obimbo Lab. The first and most important is the microbiome work. And we have team members who are working on vaginal microbiome, that's led by me. There are others who are working on gut microbiome as it relates to women's health. We also have an intervention on One Health, looking at the environmental, soil, and gut microbiome. So that's one of the areas to understand how microbiome science plays in the whole series of health, and how we can use the microbiome science to intervene, especially in the area of precision medicine, or precision public health medicine. So my team, we are looking at the vaginal microbiome and metabolomics. I'm the principal investigator, and I'm also a Callisto Juma Fellow, funded to work on vaginal microbiome as it relates to adverse pregnancy outcomes. And what we are looking at in each of the gestation is what are the variable sequences in each of the trimesters, what are the metabolomic profiles, and then linking this to the clinical data. The main aim of this study are twofold. One is to come up with early predictive biomarkers that can be able to tell which pregnancies are at risk, and therefore we can address them early before they actually get the adverse outcome. And the second is to also just understand the mechanism by which the vaginal microbiome and metabolomics interact, and with that we should be able to help in the design of live biotherapeutic, especially in the emerging science of biotherapeutics and microbiome treatment, to create what we so-called the next generation probiotics. So the introduction of the MiSeq, the i100 Plus, is really a game changer in terms of the work that we are doing. It's very clear that this MiSeq will reduce the amount of time we are using to do our sequencing from the old one that we used to do about 58 hours to now 15 hours maximum. You can get your data to as soon as 4 hours. So it means our productivity will definitely go high, and the dangers and encumbrances that were associated with the storage of cartridges, the reagents, have been eliminated, because now we don't have to do cold chain storage, we can do over-the-shelf storage. So this would really impact on our productivity and the value of science that we're going to be demonstrating.
Probably if I would talk of the advantages of now having the experience of using both machine and having done several assays on it. First of all, I'll try to emphasize that this machine is like the first time we are using the MiSeq i100, and I'm really amazed with the effectiveness and the quickness by which we are able to get data. For example, in our assay, we were expecting to get results with the MiSeq Legacy after 58 hours. But then with the MiSeq 100, we're able to get the results within 15 hours, which means we could do several runs in a week.
I foresee that the genomics and omic technology basically as one of the future of medical practice. And as we are heading towards personalized precision medicine and public precision medicine, genomics, transcriptomics, metabolomics, all the omics will come into play, because then people will be treated according to their gene, people will be treated according to the product they produce from the gene interactions. And so going to the future, the genomics is going to be the cornerstone of treatment. As a matter of fact, we'll be looking at shortly how the various drugs interact with our own bodies in the so-called pharmacogenomics. And with that, we want patients treated with a dose that fits them and with a drug that they can be able to metabolize in good time to achieve that treatment. So going forward, we will be shaping policy in terms of having personalized medicine other than just having generic treatment for our patients. I've had very productive collaboration with the Illumina and the FNS team as their lead representatives in this country. FNS management has been very kind with Dr. Rushabh working very closely with us, and he's lent us his very experienced team members led by Peter, Cecilia, David, who have worked with us from time to time and just guiding us, because working with the vaginal microbiome was still a very new concept in our lab, and so the team has really taken us through, supported us along, and we feel very seasoned and happy to give results. So our collaboration is envisaged to go beyond just the science and dig deeper to see if we can actually be able to do product development.
African researcher should go to the genotyping way. We're really moving from using symptoms and to use actual data to inform our health decisions. So if this is something that could even be incorporated in the hospitals in terms of diagnostic, that will be something I'll be really happy, because at the end of the day, it's like Illumina is helping me fulfill my purpose in this world.
We need more research, and in this research that we need to do it in communities that, even in people who are vastly affected by this, by example, concerns in the public health landscape in Kenya. So we need people who can be able to go to in the communities, engage the communities.
My final statement and call to action is two things: that the future medic, the one we are training to as a doctor, nurse, pharmacist, dentist, will make a better doctor if they also became a scientist, because then you understand what science is all about and what science implies on the medical practice. I want to encourage the young people who are thinking of following my pathway as a clinician-scientist, now turned also clinician-scientist advocate, that we can be able to make a difference in all the spaces that we work in, whether we're doing neuroscience, gut science, cardiac science, and for us who are doing reproductive sciences, that you can make a great impact in every area and every space that you're working in.